You have seen him change his mind, you said, when you sent evidence to him. So my question is, have you shown Secretary Kennedy the existing evidence that shows that vaccines do not cause autism? Please talk into the mic a little bit closer.
Oh, I'm sorry.
Thank you.
Thank you for that question, Senator. I mean, and I've said that publicly, and I've said that privately.
Please say it again loudly and clearly so parents all over this country can hear you. Please say it again.
Yeah, I mean, I think the best way to address the measles epidemic in this country is by vaccinating our children with measles.
Thank you very much.
For several years by the public regarding.
I'm sorry to interrupt you. I don't have a lot of time. You're right. There is deep mistrust. Do you think that deep mistrust now has something to do when you have an organization like the American Medical Association?
2024, there was a study published in the Journal of the American Medical Association that said that only about 40% of patients still trust their doctor. Chairman Cassidy, Ranking Member Sanders, and distinguished members of the committee, thank you for the opportunity to discuss modernization of the National Institute of Health. I'm honored to lead the NIH, where research investments have supported major advances in human health and disease over decades. The chronic disease crisis facing the American people is severe, with unacceptably high rates of diabetes, heart disease, cancer, Alzheimer's disease, and so many other conditions. Life expectancy for Americans is barely above 2010 levels. The solution to this problem is to modernize the NIH to fulfill its mission of investing in research that improves the health and longevity of Americans. Some NIH investments have a track record of success. For example, just this year, decades-long work of NIH-supported researchers culminated in not just one, but two new gene therapies to cure sickle cell anemia. When I was in medical school learning about the sickle cell disease, I never expected to see a cure in my lifetime, and yet here we are, thanks to NIH-supported research. NIH-funded researchers built on this gene editing technology to deliver personalized treatment to an infant with rare, previously fatal disease. You may have heard of baby KJ. The treatment was supported by the NIH Common Fund, which with Senator Cassidy you mentioned, the Common Fund Somatic Cell Genome Editing Program. But despite these incredible successes, we can do more and we can do better. And as director, one of my top priorities is to rebuild public trust in the NIH. Meaningful reforms that increase transparency, strengthen scientific rigor, and ensure accountability are necessary to bolster the NIH's ability to meet America's current and future public health needs. The NIH is a large and complex organization operating in a rapidly changing technological environment that is accelerating discovery at an unprecedented pace. As science itself evolves, so too must the structures that support it. Under my leadership, reform is already underway at the NIH. We are consolidating and restructuring core functions within the Office of the Director to enhance coordination and improve efficiency and strengthen accountability. For instance, we've centralized peer review, which is the basic and most important function of evaluating scientific grants. This consolidation is projected to save millions by eliminating duplication while ensuring more consistent, agnostic, rigorous scientific evaluations of research applications. A new office within the Office of the Director will support rigorous analysis of the NIH research portfolio with the mission of coordinating NIH investments to solve the replication crisis in biomedical sciences, leading to greater impact of our scientific investments on population health. In concrete terms, I expect these efforts will deliver greater value for every taxpayer dollar the NIH is entrusted with. Through our new unified funding strategy, the NIH is empowered to make research portfolio decisions that are better aligned with the strategic priorities of the institutes and to take advantage of research opportunities in every field of biomedicine and the urgent health needs that our country is facing. To improve public health, scientific discoveries must be translated into more effective interventions. The NIH is investing in new human-based models and emerging technologies to improve the translatability of research into human health and responsibly reduce animal research where scientifically appropriate. The NIH is actively engaging with the White House and other federal partners to develop and implement a policy for increased oversight of dangerous gain-of-function research. This is a necessary and long overdue step to ensure that NIH-funded research does not lead to significant adverse social consequences. In addition to the reforms underway, we're pursuing additional opportunities to steward taxpayer dollars responsibly and keep pace with a rapidly evolving scientific landscape. We need to invest in and support young scientists to build and retain the brightest biomedical workforce in the world. We also need to move the needle and incentivize high-risk, high-reward research. Research portfolios at the NIH under my leadership will be judged by their success at curing disease, improving population health, and creating fundamental scientific breakthroughs, rather than simply how many scientific papers each project yields. Serving alongside the extraordinary scientists of the NIH and across the country, as well as the dedicated colleagues of the NIH, is a privilege in my professional life. I'm committed to restoring trust in the NIH and building a more accountable, transparent agency that leads to discoveries that enable Americans to live longer, healthier lives. Congress is an essential partner in these efforts, and I want to thank you for your time today, and I look forward to your ideas and questions.
Dr. Bhattacharya, according to the American Medical Association, which represents over 270,000 doctors, quote, an abundance of evidence from decades of scientific studies shows no link between vaccines and autism, end quote. That includes over a dozen rigorous scientific studies involving hundreds of thousands of children. Last week, you said, quote, the caricature, end quote, of Secretary Kennedy you've seen, quote, in the press is just totally unfair. You have seen him change his mind, you said, when you sent evidence to him. So my question is, have you shown Secretary Kennedy the existing evidence that shows that vaccines do not cause autism? What steps are you taking to make sure that our nation's health policy is guided by scientists and not conspiracy theorists?
Well, Senator,
Please talk into the mic a little bit closer.
Oh, I'm sorry, Senator.
Thank you.
Thank you for that question, Senator. I mean, I'm absolutely convinced that, for instance, the measles epidemic that we're seeing currently is best solved by parents vaccinating their children for measles. And I've said that publicly, and I've said that privately.
Please say it again loudly and clearly so parents all over this country can hear you. Please say it again.
Yeah, I mean, I think the best way to address the measles epidemic in this country is by vaccinating our children with measles.
Thank you very much.
I've also heard Secretary Kennedy say that publicly. I mean, I think, as I said in that, as you said in that quote, I've seen him caricatured quite unfairly. I think the key thing to me is that we have to address the deep distrust that has developed over the last several years by the public.
I'm sorry to interrupt you. I don't have a lot of time. You're right. There is deep mistrust. Do you think that deep mistrust now has something to do when you have an organization like the American Medical Association telling us that vaccines do not cause autism, but you have a secretary of HHS who says the very opposite? Do you think that causes concern and mistrust among parents?
You know, Senator, in 2024, there was a study published in the Journal of the American Medical Association that said that only about 40% of patients still trust their doctors. As someone who went to medical school myself, it's absolutely shocking. And that's before Secretary Kennedy took office. We have to address this mistrust, but it has to be a bipartisan effort.